Thank you. Teddy would have loved this celebration. As everybody who knew Teddy knew, he loved a party, especially a birthday party. And for 60 years, you really deserve quite a celebration. To be 60 again. Seriously, though, and I think all of you know this, community health centers were near and dear to Teddy's heart. I would go so far as to say that community health centers are really the spark that lit the fire of passion that he called the cause of his life: access to quality health care for all Americans. I can still hear his voice in my mind's ear when he'd say, "And when I say all, I mean all." Teddy was just 33 years old when he first met Jack Geiger and Count Gibson, and they talked to him about the promise of community health centers, about breaking down barriers to access and delivering comprehensive health care services to people where they live, in their communities. He loved the model. He understood that better health could only be achieved with a great healthcare delivery system. Care has to get to the people, he would say. He was thrilled to tell the story of the 1966 legislative birth of the Community Health Center movement in his memoir, True Compass. He loved the story. He had recounted it to me more times than you can imagine. He wanted $38 million for 2 health centers, the one here at Columbia Point and one in Mound Bayou, Mississippi. But he needed to get the approval of Congressman Adam Clayton Powell of New York, the powerful Education and Labor Committee chairman in the House of Representatives. Powell was a character, to say the least, and he wielded power with great vigor, I guess you could say, and enjoyment. Teddy was just a freshman senator, and Powell believed in seniority. Teddy went at the appointed hour to Powell's office for their meeting, but the chairman made Teddy wait, and wait, and wait, and wait. Hours went by as Powell sifted through every paper on his desk. He'd steal a glance at Teddy every now and again and say, "I'll be with you in a little while. Senator, if you want to come back later." But Teddy wasn't going to risk being shut out, so he said, "No problem, happy to wait." And he did. What Powell hadn't counted on is that Teddy was the 9th child of 9. He was very used to waiting his turn, very, very, very used to waiting his turn. After about 4 hours, according to Teddy, Powell made it through the stack of letters on his desk and finally turned and said, "So Teddy Kennedy, you want these neighborhood health centers." By the end of that meeting, Teddy had authorization for Columbia Point and Mound Bayou and another one in Powell's district. And as Teddy wrote in his memoir, that was the beginning of neighborhood health centers across the United States. Thanks to the vision of pioneers like Drs. Geiger and Gibson, and the advocacy and willingness of a young senator from Massachusetts to wait and argue his case for community health centers, that support was written into the law of the land. And tonight we're celebrating this 60th anniversary and nearly 34 million people served at 1,700 locations spread across the land.